In the middle of the night, Byron Stribling found himself driving 110 miles per hour in search of critical medical care for his pregnant wife, Harmony. She was in the passenger seat and was due in 4 days.
Between 12:30 and 1 a.m., she came in the room and was complaining about having chest pains.
The couple lived in Belzoni, Mississippi, a city whose only hospital had closed 8 years earlier. The closest hospital was 30 minutes away, and Harmony needed medical attention immediately.
She was, having seizures or heart attack. I was driving. I had my AirPods in and I called 911, and they were telling me that she needed immediate oxygen, so they needed me to pull over right then and start CPR.
And that's exactly what Byron did, on the side of the road, in the dark, 2 minutes from the Yazoo City Hospital. The ambulance took another 15 minutes to get to the scene, but it was too late.
If my wife had oxygen sooner, it's a possibility that my daughter would have survived. And who's to say it's a possibility that she would have survived?
Tragedies like Byron's play out all across rural America, where a total of 195 hospitals have closed since 2005, and 600 more are on the line. These hospitals aren't closing because rural Americans require less care. No, that would make too much sense. What's actually playing out in plain sight is maddening. Health insurance companies and politicians playing partisan games have conspired to create a crisis with life-threatening implications. Byron's home state of Mississippi is the poster child for this. Nearly 50% of the state's rural hospitals are currently in danger of closing. So we went to the Magnolia State to investigate what happened, who exactly is responsible, and how simple solutions with nearly zero cost could stop these lethal closures, potentially saving lives like Harmony's.
Where we're sitting at today is in the closed wing of the hospital. We have two, a west and an east wing, 25-bed inpatient unit. And so on this side, we closed it down a little bit less than a year ago.
Lee McCall is the CEO of Neshoba County General Hospital in Philadelphia, Mississippi, one of the 34 hospitals at risk of closing. Rural hospitals like Lee McCall's face three main obstacles to staying afloat: private health insurance companies not paying enough, Medicare not paying enough, and partisan politics keeping far too many Americans uninsured. I'm going to take you through all three of these, one by one. To start, let's talk about the first obstacle for rural hospitals: private insurance companies.
There is one big difference that we've seen in terms of the hospitals that have closed and are at risk of closing and those that have not closed and are not at risk, and that is how much they're being paid by private insurance plans.
That's Harold Miller, the author of this report on rural hospital closures.
The tradition in America for many years has been that healthcare providers and insurance plans negotiate to determine what's the right amount to pay. And the challenge is that bigger hospitals are in a much better position to negotiate with a big insurance plan than a small hospital is. So in many cases, the insurance plan says, here's what we're going to pay you. We're not negotiating. And so rural hospitals are increasingly now facing greater losses because their costs have been increasing, and the payments to be able to address those costs have not been increasing proportionately.
Harold advocates for changing the structure of how insurance plans pay hospitals, particularly small rural hospitals like Neshoba General.
So rather than simply paying them whenever they deliver a service, it would actually make sense to pay them for both of those services that they deliver. A standby capacity payment that gives them enough payment to be able to cover the minimum costs of being on standby for emergencies and other essential services.
States have the power to intervene and moderate hospital prices. One state in particular has done a great job addressing this. In Maryland, the state government regulates the fees that hospitals charge for services and requires all insurers to pay those fees in full. This means private insurers are barred from underpaying rural hospitals. As a result, Maryland has fewer rural hospital closures than any other state in the U.S. The second obstacle for rural hospitals is Medicare. Medicare has long been one of the best payers for rural hospitals, but that changed under Ronald Reagan.
In the 1980s, when the federal government changed how Medicare was going to reimburse all hospitals, it had a much greater impact negatively on rural hospitals than I think that they anticipated.
Chad Netterville is the executive director for the Rural Hospital Alliance in Mississippi. a network of 41 rural hospitals collaborating to survive in this catastrophic environment. Chad explained that instead of reimbursing hospitals the full cost of delivering a health service, Medicare began to pay a fixed fee for each service. But they based that fixed fee on data from big city hospitals, neglecting the fact that small rural hospitals tended to require more money to deliver the same services. This is because there are fewer patients, and therefore fewer payments to sustain basic hospital services. Over 400 rural hospitals closed in the 80s and 90s because of this change in Medicare funding. The government's response to these closures was to create a special category of Medicare funding for rural hospitals in 1997.
They were doing things to create an opportunity for these rural hospitals to stay open and survive, because they did not and couldn't afford, nor did the larger hospitals want all these rural hospitals to close.
But in the decades since that change, budget cuts have eroded that funding, as has the fact that more and more patients are moving to Medicare Advantage plans, which puts private insurers driven by profit motives in charge of paying hospitals. In an effort to address this issue, Congress has introduced the Save Rural Hospitals Act, which would establish a fairer Medicare reimbursement rate for care. If passed, it could bring desperately needed federal money to rural hospitals and help avert closures. The third culprit behind rural hospital closures is more political and petty. In 2010, Democrats expanded Medicaid to cover hundreds of thousands of uninsured Americans. But Republicans in many states, including Mississippi, refused to expand the program. Not because it would cost the state anything, just out of pure political spite.
Here in Mississippi, your leaders stood strong and stopped the expansion of Obamacare.
And that brings us to our third obstacle, Republicans' refusal to expand Medicaid, a decision that has unnecessarily left 230,000 Mississippians uninsured. Unsurprisingly, states that did not expand Medicaid or only chose to do so during the pandemic account for nearly 75% of rural hospital closures in the last 10 years.
About 10% of what we do is uninsured, uncompensated care. When a patient walks through the door, we take care of them, irregardless of their ability to pay, and we worry about that part later. The actual cost attributed to uncompensated care is around $5 million. So annually out the gate, we're in the hole $5 million that we're trying to make up.
Expanding Medicaid would provide $1 billion to the state from federal coffers to help cover the cost of health care.
It would help our hospital by offsetting the uncompensated care costs. It would help those individuals who are uninsured or underinsured be able to access health care and have it paid for without jeopardizing their livelihood or ability to put food on the table or pay their bills.
Despite widespread support from healthcare groups and the majority of Mississippians, expanding Medicaid has remained politically contentious. So much so that it has become the defining issue of this year's governor's race between incumbent Tate Reeves and Democratic challenger Brandon Presley.
Right now, there are 38 more rural hospitals just like the one I'm standing in, and they're on the brink of shutting their doors. If hospitals continue to close, the impact will be catastrophic.
But it looks like the tides may actually be shifting. Though Governor Tate Reeves remains opposed to Medicaid expansion, the incoming Speaker of the State House, a Republican, has suddenly put Medicaid expansion on the table.
I will admit and say, there's a reckoning coming for healthcare, not just in Mississippi, but nationwide.
Disasters like Byron's are avoidable. State legislators need to expand Medicaid. Congress needs to pass the Save Rural Hospitals Act. And states need to step up and regulate private insurance companies. For people all across rural America, this is a matter of life and death. Thanks for watching. And as always, don't forget to like and subscribe to see more videos like this one. If you have ideas for what stories we should uncover next, drop them in the comments.